All right, good afternoon. Thank you all for joining us for our visit with TrustPoint Hospital. My name is Beth Duffield with the Rutherford County Chamber of Commerce, and I'm excited to welcome Veronica and Brindley to present to you all about all the great opportunities available at TrustPoint Hospital here in Murfreesboro. Just a couple of housekeeping items. If you have questions, if you would use the chat feature at the bottom of your screen, and we will save time at the end of the presentation for questions. And we are recording this, so you all can come back and watch this later if you have any other questions. And I know that Veronica and Brindley will be giving you instruction on how to reach out to them or to TrustPoint to apply for their jobs. So Veronica and Brindley, I'm going to turn the screen over to you.
Great. Well, I'm Veronica Nava, and I'm Brindley Gingrich, and we are the HR coordinators here at TrustPoint Hospital. So who are you, we may ask? Well, TrustPoint Hospital is a state-of-the-art treatment center that provides an array of medical and psychiatric services on both an inpatient and outpatient basis. We are located off Thompson Lane, adjacent to the Stones River battlefield. Our mission here at TrustPoint is to be dedicated to ensuring the safety and continued well-being of all who are entrusted to our care. When patients enter the treatment of TrustPoint, they and their family members feel secure in the knowledge that safety is the primary concern here and focus in all that we do. So you can see our mission and vision there. So we do have some different programs here. We have a behavioral and physical medicine and rehabilitation. But TrustPoint Hospital provides leading inpatient psychiatric programs of individuals experiencing crisis from substance abuse or mental health issues. So we offer a safe environment to help adults regain control of their lives. What we treat is anything from Alzheimer's disease and dementia, anxiety, bipolar disorder, depression, psychotic disorder, PTSD, co-occurring disorders, complex medical conditions, and drug addiction. We also have a physical medicine and rehab program, which focuses on areas of therapy such as physical, occupational, speech, and respiratory, as well as activity therapy for our patients. It's designed for people 15 and older and offers superior care for their individuals to regain their sense of personal independence. We also have included an outpatient therapy clinic, which is across the street from us off Medical Center. It's called Clear Path. And we have physicians that go there and they can continue to prescribe and treat patients even if they have left our facility. So we had current technical difficulties, but our CFO, our CEO is Mary Beth Goodner. We call her Beth. And her video pretty much was just kind of really encouraging everyone to apply to our hospital if you are interested. She loves what she does, and she's here to support the employee, the staff, management, every department. And we really do hope that you guys are able to apply and understand that we are looking for employees and candidates that are really trying to be a part of the TrustPoint team. But let's continue on with the departments that we currently have. So as mentioned previously, we have a lot of positions available currently in several different departments. These are several departments that we have open positions in. Obviously nursing, we're looking for RNs who are qualified, as well as patient care technicians. With a patient care technician, you do not have to have a CNA certification. We train in-house. So you can come straight in without experience and we will train you for that patient care tech position. We also have some availability in social work as well as therapy. Those therapies we discussed earlier, like recreational, occupational therapies. Behavioral health associate is another word for our patient care techs that I discussed. The business department, The financial counselors will have positions available, as well as environmental services. So that could be housekeeping, facility management. Our dietary department is always looking for new applicants, and our maintenance department currently has a position available as well for a tech. So most of these positions, some of them are entry level, and then others are mid-career level, full-time and part-time positions. We offer PRN for our nursing and our techs. Here is a little bit of a screenshot of where you would go to TrustPoint Hospital. You would go to the careers at TrustPoint, and then the view open positions is what you would select. It would take you to a link where it will list everything that we have available for TrustPoint, and that link would say Acadia, because our hospital is owned by Acadia Healthcare. But this is just so that you are aware how to get to the website. Sometimes you will also see postings on Indeed, because our postings from TrustPoint go directly onto the Indeed site. So no matter where you apply, they'll all filter to us, regardless of if you apply on Acadia's website, TrustPoint's, or Indeed's. So this is Brian Webb, our Director of Facilities. He is over our EVS, our Environmental Services, over maintenance. He is also even taking now a little bit portion of our operations, as far as all of our units that we have. So he is looking for a maintenance tech PRN position. He's also looking for some housekeeping positions. Those are full-time and some are part-time as well. And there are a lot of dietary positions as well, things like dietary aide, cook. Those are the main ones that we're currently looking for. So those are the opportunities we currently have, and you can visit our website to see specifically what position is open. So all of those positions, the maintenance, the EVS, and dietary, those are based on experience and education, but these are just our base pay, starting pay rates. If you are interested in knowing that, they both start off at 11 for the EVS and dietary, and maintenance is just depending on experience and education. Those very well, they vary. So on the next slide, once again, a little video technical difficulties, but this is May Farrell. She is our IOP, which stands for Intensive Outpatient Therapy Coordinator. So a cool part about TrustPoint is we not only want to serve our current patients, but once they leave, we want to take care of them as outpatients as well. So she is the coordinator over the IOP program. So she has a lot of different counselors under her who have evening, morning, sometimes even weekend counseling sessions for those outpatients to come to. And she currently has positions available for counselors that she is looking for. One is full-time evening position she has available, and then one is a part-time position. So those counselors obviously have a great impact in our patient lives, even after they leave the facility. This is Angela McCartney. She is our nurse manager over the ADU and co-occurring units. She is looking for warm hearts, not warm bodies. She wants to really bring someone to the team that understands and has that empathetic quality that we look for. Our patients here vary from so many different types of different behavioral health and mental health issues. So she's looking for nurses and techs that are really there to support our patients. She currently does have full-time and part-time positions, and any of our other units, as we mentioned previously, whether it's on our geriatric, our adult, our adolescent, our child unit currently is not open. However, they will be, I think, extending that towards the end of the year, if not beginning of 2021. But all of our units right now go across the board of all ages. So we're looking for nursing techs and nursing registered nurses to be able to participate and help all of our family here just grow. And we are growing tremendously, even though we are in the middle of a pandemic. Our hospital currently has 217 beds, and we are not at full capacity at the moment, but we are definitely, that is our goal.
The more positions we can get filled, the more beds we can open.
Mm-hmm.
So there are quite a few COVID adjustments we have been making, because just as Veronica stated, we are in the middle of a pandemic. And we know that dealing in a hospital with patients, we are essential workers who have to be here. So we want to make sure we can keep our staff safe while they are here, as well as our patients. So a few of those adjustments, one of which is the 3 entrances we have, all have temperature checks that will be given to all of visitors coming in, as well as staff. We also have temperature checks on the units whenever they come in at 7A or 7P for the different shifts. Masks are required as soon as you enter the facility for visitors and for patients. Social distancing has been a big requirement for us. And then sanitation systems have been throughout the hospital. We actually added a few new sanitation systems, as well as
a student health screening
yes.
station. So our student education program here at TrustPoint Hospital, we do have a lot of students that come in and out. So they have their own particular station where they will complete a COVID screening form and check their temperatures and give us all that information, because what we care mostly about is the safety of all of our employees, our patients, and our visitors. So some TrustPoint benefits here. These are the good parts. We have a few. Of course, we offer our medical, dental, vision insurance, life insurance. We do have a 401k match, short-term and long-term disability. We have, who's our medical? It's Blue Cross Blue Shield, and Delta Dental, and VSP.
And all of our full-time employees or employees who work over 30 hours a week are eligible for any of those benefits to enroll in. There is not like a 90-day waiting period, as there are at some jobs. It's typically a 30-day to enroll, and then the benefits will take effect that next month. We also have an employee referral program. So if an employee who is currently working here refers you as a new hire, that employee, after you have been working here 6 months, they would get a $250 added to their check, $250. And then after you have been working a year, that employee would get $250 more. And then once you become an employee, you can automatically start referring people and get the same bonus.
In addition to that, we also have a discounted, kind of like a program that Acadia has for all of their facilities and all of their employees. It's called Perk Spot. We can view local discounts, and they have deals from anything that has to do with health and wellness, flowers and gifts, automotive, food, home services, auto buying, tickets and attractions, and even apparel. So I know I've been able to get some good discounts going on some vacations. So.
Cell phone discounts too.
Yes, we do have for cell phone discounts.
And then there is a compliance incentive program that we are just starting now at TrustPoint. So basically, whenever you come on, you'll have some requirements in terms of like trainings. We use a health stream system and things like that. So as long as you remain compliant, you're doing what you're supposed to here as an employee, then each month you'll be entered into a drawing to win a gift card. And then every quarter, if the unit that you are on is compliant, has been compliant throughout the quarter, then you are eligible for, as a unit, for a party of sorts. So we'll kind of like decide each month or each quarter what that event will look like.
A few other benefits we have, which is one of our favorites, is our annual employee gathering. Every year we do have a time where we will all come together and enjoy a day with family and friends. There'll be food, prizes, games, and this time is really just to appreciate the past year that we've been together and everything that we've gone through, just because we've been growing so quickly. So these annual employee gatherings are one of our favorites.
And we're having one this upcoming month too. So it's something to look forward to. And then monthly, we like to celebrate both birthdays and anniversaries of our employees. So we'll do the end of every month a little celebration. So we'll have some type of treat that we distribute throughout all the units for day and night shift, just to say thank you. We'll send out like bulletin emails with everyone's name whenever it's their birthday, anniversary, or if they're a new hire. We nominate one person. We call them an owl of the month, somebody who has went above and beyond. It was nominated by one of their peers. And we just acknowledge them as well, so we can show all the work that is being done behind the scenes here at TrustPoint.
Here is just some pictures of some of our staff just messing around, taking pictures. There's Brinley in that first picture.
So we celebrate hospital week in May too. So we have like the treat cart that goes around to all the units. Everyone can get a treat every day of the week. And then we like dress up throughout the week too. So just something fun.
So this, to conclude, we had a video from our HR director, Carrie Lovett. And just encouraging and thanking everyone for participating in this virtual job fair that we have for Rutherford Works. You know, being part of Rutherford County, being part of our community, we have a large population here. And I think that, you know, we're looking for anyone who is willing to just be able to show that love that these patients really need. And I mean, we look forward to everyone applying to our hospital. If you visit our website, it's www.trustpointhospital.com. Does anyone have any questions? Did you want to say anything, Brinley?
I was just going to encourage you all, regardless of if you have nursing experience or not, like we said in the earlier slides, we have entry-level positions like patient care techs, dietary, housekeeping, facilities, maintenance. And we also have nursing positions as well and social work positions. So we have a little bit of anything for anybody.
And those are updated almost on a weekly, if not daily basis. You know, we have so many opportunities that at one day we may not have one open and then the next we do. Yeah. So even if there isn't something that you're looking for at this very moment, I would say continuously just double check our website because, you know, there's always things that are posted on a different day.
And we hope you can be part of our TrustPoint team.
Yes.
Okay.
Well, ladies, thank you so much. I actually have a couple of questions for you. So you talked about someone coming in as a patient care tech and that they don't have to have a CNA license to do that. Can you talk about other types of training that you provide within the hospital and opportunities for advancement or career tracks that you have?
So in terms of our patient care techs, for example, so we will have orientation just like we will for our nurses on the floor where they will train with other experienced nurses or techs until they feel comfortable on their own. And then with our social work positions, we have a lot of social workers who come in with maybe just their masters of social work. And then throughout their time here, we encourage them to continue to work towards their licensure. And then when they can kind of move up from there. Each time there's a transition in like education that can also increase pay and position. So anything else?
Do you offer educational reimbursement? So if I wanted to go back, if say I was a patient care tech and I wanted to become an RN.
That is something that we are looking into, but it's not something that we offer at this moment.
Well, I think you offer lots of fun stuff, so I think I would enjoy working there. I like the parties. It's challenging. It's a rewarding job, but I'm sure it's challenging too, especially right now in COVID. And I really appreciated how you talked about all the different ways that you all are the methods that you're taking to make sure that your employees and patients are safe. I know that that's really a big concern to folks right now as they're looking to re-enter the workplace. Well, I just want to thank you all again for taking time to be with us today, to Veronica and Bryn for signing on, and I have to apologize. We had some technical difficulties. They had these great videos prepared, but they did a great job of sharing, I'm sure, everything that the folks were going to say. And thank you all, our job seekers who participated. I hope you'll check out all the great jobs at TrustPoint Hospital, and best of luck on your job search. Thank you and have a great day.
Thank you
Thank
all.
you.